Hi guys, my name's Melissa Petro. I worked with Molly and Christina on Medicare. I chose to interview my grandfather on his experience with the program. But before I discuss our interview, I'll first give you a little overview of what Medicare is. Medicare is a federal health insurance program for people who are 65 or older and certain younger people with disabilities. There are 4 parts to the program. Part A covers hospital insurance, Part B covers medical insurance, Part C covers Medicare Advantage plans, and Part D covers prescription drugs. We chose to focus on Part B, though, which covers certain doctor's services, outpatient care, medical supplies, and preventative services. A little bit about my grandfather. He's an 82-year-old Caucasian male. He is 100% Slovak, but has lived in the United States his entire life. He's a high school graduate with some college education. He attended Ohio State in 1949 for a couple years, but never ended up graduating. In 1951, he joined the service and served in the Korean War for 2 years. And after the war was over, he worked various different side jobs and later began working as an industrial specialist for 15 years. This was a federal government job, and he worked under the Small Business Administration and the Department of Defense. And as an industrial specialist, he would go out to companies that wanted to have a contract with the government to do work and make parts. And he would go to these different companies and looked at what they were doing to make sure that they were doing things correctly and efficiently. And his goal was to make sure that they were meeting all the requirements of the contract. And after he visited each company, he would write up a report called the pre-award survey of why or why not he thought that they were doing their job correctly and efficiently. And because this was a federal government job, he received health care benefits, and they paid for his health insurance. And when it was time for him and my grandmother to retire, they were able to take their health benefits and carry them over into retirement, which was nice. And my grandfather married my grandmother in 1958. They had 4 daughters together, one of which being my mother. He was Catholic, and he raised his daughters as Catholic as well. They are of middle socioeconomic status. Both my grandmother and my grandfather worked, and they were able to send all 4 girls to college. My grandfather he has a strong social support network. He's very close to our family. He still has my grandmother around, which is good. He received Medicare when he was 65 in the year 1996. He has had an overall healthy record throughout his life, and besides having a bit of high cholesterol, his medical record looked pretty good. But in 2011, at the age of 81, he had a bit of a hiccup. One morning, my grandfather began complaining to my grandma that he wasn't feeling well, and my grandmother noticed that his speech was off and he had a high temperature. So she called the ambulance, and he was taken to the emergency room. And the doctor ran some tests, and he was admitted to the ICU. He was in the ICU for 9 days, and during these 9 days he suffered from high fevers and fluctuating blood pressure. He was administered different medication to help with these symptoms. The doctors ran tests and did an MRI in order to figure out what was going on. And the doctors eventually came to the conclusion that it was a very severe bladder infection that probably went undetected for some time, and especially in the elderly, bladder infections can be quite serious. So from there he was sent to a rehabilitation center close by. He was there for 3 weeks, and during his stay he went through speech therapy for slurred speech. He did physical and occupational therapy until he was able to walk on his own. My grandfather had to use Part B of Medicare in order to cover prescription drugs and all kinds of therapy. Medicare is his primary insurance. Anything that Medicare didn't cover was covered by his secondary insurance, which was Anthem Blue Cross. And Anthem Blue Cross was medical insurance he received from his government job. Um, kind of switching gears a little bit, one social problem that was occurring during the time of my grandfather's incident um, and the time period of our group's assigned chapter in Chapter 11 was the financial crisis. And the financial crisis of 2007 to present has affected and probably will affect Medicare and other social programs across the board. With the U.S. being trillions of dollars in debt, it's predicted that lawmakers will likely target Social Security, Medicare, and Medicaid. Um, but thankfully, my grandfather was able to get the coverage he needed in the midst of this crisis. Him and my family are very thankful for Medicare. Without it, he would have to worry about his medical bills and expenses, which could have put stress on him and hindered his recovery at age 81. So, but he is fully recovered today, and his health is under control at the moment. And just overall, it's really nice to know that, especially with Medicare, if something does happen in the future, that he will get the care that he needs. So, thank you.